Next, that is iron deficiency anemia. So before that, what is meant by hematological diseases? Yes, hematological diseases are the pathological condition in which it directly affects blood of the blood producing organ. So hematology, it means it is the study of blood in relation to health and diseases. It includes problem with RBCs, WBCs, platelet, blood vessel, bone marrow, lymph nodes, spleen, and protein. And the protein involved in the bleeding and clotting, that is hemostasis and thrombosis. Yes, hematology, it means diseases which are related to your blood, that is related to red blood cells, white blood cells, platelet, blood vessels, then bone marrow, lymph node, spleen, then protein which are involved in bleeding as well as clotting, that is hemostasis and thrombosis. First, that is iron deficiency anemia. Yes, iron deficiency, of course, it is a type of anemia. It is a condition in which what will happen, in which there is the blood lacks adequate healthy red blood cells due to the deficiency of iron. Yes, this iron deficiency anemia, in which, or is the condition in which what happen, there is the blood lacks adequate healthy RBCs due to the deficiency of iron. Its name itself indicate iron deficiency. It means there is deficiency of iron in the RBCs. So what is role or what is function of RBCs? This red blood cells supply oxygen to the whole body. Without enough amount of iron, the body can't produce enough of hemoglobin. Yes. So what is function of RBC? The red blood cells supply oxygen to the whole body, and without producing without enough amount of iron, the body unable to produce sufficient quantity of hemoglobin, and due to this what will happen, there is iron deficiency anemia. And due to this iron deficiency, it produces tiredness and shortness of breathing. See here, I am repeating. So what is function of RBC? This red RBCs can supply oxygen to the whole body, and without enough amount or the sufficient quantity of iron, the body unable to produce enough quantity of hemoglobin, and due to this what will happen, due to this there is deficiency of iron, that is iron deficiency anemia, and it produces the tiredness and breathing shortness, that is shortness of breathing. Then this iron is distributed in active metabolic and storage pools. Total body iron is about 3.5 gram in healthy men and 2.5 gram in men. Yes, for men it is 3.5 gram, and for women it is 2.5 gram. And the difference relates to women's smaller body size and death of stored iron because of iron loss due to the men's. Then the distribution of body iron is likewise in that first hemoglobin, it is 2 gram in men and 1.5 gram in women. Then ferritin 1 gram in men and 0.6 gram or 0.6 gram in women. Then hemosiderin, it is 300 milligram. Then myoglobin, it is 200 milligram. Then tissue enzymes, that is heme and non-heme, it is 150 milligram. Then transport iron compartment, it is 3 milligram. And basically the iron which is absorbed in, where it is absorbed, this iron which is absorbed in duodenum and upper jejunum. Yes, where the absorption of iron takes place, the iron is absorbed in duodenum and jejunum, and this dietary iron is usually in the ferric state. See here, what is this? Keep in mind this dietary iron which is basically in a ferric state and which need its conversion to ferrous state for their absorption. Basically, this dietary iron which is available, which is in a ferric state or which is in ferric form, which needs to conversion into the ferrous state for their absorption. The iron from intestinal mucosal cells is transferred to a transferrin, and this iron transport protein is synthesized in the liver, and this transferrin can transport iron from a cell, that is intestinal or the macrophages, to the specific receptor on erythroblast or the placental cell or the liver cell. Then for the synthesis or for the heme synthesis, this transferrin transport iron to the erythroblast mitochondria, which insert the iron into the protoporphyrin for it to become a heme. Yes, for heme synthesis, this transferrin which is transport iron to the erythroblast mitochondria, which insert the iron into protoporphyrin for it to become a heme. And this synthesis of transferrin which increases with iron deficiency but decreases with any type of chronic disease. Generally, this iron which is stored in two forms, that is ferritin and hemosiderin. Yes, keep in mind, basically this iron which is stored in body in two forms, that is ferritin and hemosiderin. The most important, that is ferritin, because which is a soluble and active storage fraction and located in the liver cell, bone marrow and spleen, and also in macrophages, and also the RBC and in serum. Yes, here I am repeating. Generally, this iron which is available in two form, which is stored in two form, first that is ferritin and second that is hemosiderin. The most important, that is ferritin, because or which is soluble and active storage fraction, which is located in the liver cell, bone marrow, spleen, that is in macrophages, then RBCs and in serum. And the second form, that is hemosiderin, which is relatively insoluble and which is stored primarily in the liver and bone marrow. So this is the basic of this iron deficiency anemia. Then second, that is pathogenesis. There are generally in pathogenesis there are 5 steps. Step 1, in that first, it is characterized by decreased bone marrow iron stores. Yes, in step 1, or it is characterized by there is decrease in bone marrow iron store, level of iron in hemoglobin and serum remain normal. But the serum ferritin levels falls to 20 milligram per, then it is 20, and transferrin level increases to increase in the absorption of iron. See, I am repeating here. In stage 1, it is characterized by decreased bone marrow iron storage, and the level of iron in hemoglobin and serum remain normal, but the serum ferritin level it is 20, and this transferrin level increases to increase the absorption of iron. Then in second step, the erythropoiesis is impaired. The process of erythropoiesis is impaired, and although the transferrin level is increased and the serum iron level is decreased, and this impairment of or the impaired erythropoiesis, the erythropoiesis impaired when the serum iron falls to below 50 microgram per deciliter. When this process of erythropoiesis impaired when the serum iron falls to below 50 microgram per deciliter, and the transferrin saturation to less than 16%. Then step 3, Anemia develops with normal appearing RBC and indices. Then step 4, for development of microcytosis, that is small sized RBCs, and hypochromia, that is faint colored RBC. Yes, there in step 4 there is development of small sized RBCs and faint color RBC, that is microcytosis and hypochromia. Then step 5, the stage of this iron deficiency shows symptoms and the various signs and symptoms. So what are the different signs and symptoms? In that, first, if the iron deficiency develop over a long period of time, then it causes anemia, and then the body can adjust to the new state without showing any symptom. There are different symptoms, for example, feeling tired, then weakness or the feeling of weak, then decreased work performance, then chest pain, then fast heartbeat, then shortness of breathing, headache, dizziness, then slow cognitive, that is slow thinking, then remembering and reasoning, then social development, then also slow social development during childhood, then pale skin, difficulty maintaining the body temperature, then decreased immune functions, which increases the susceptibility to the infection. Then glossitis, it means inflamed tongue, then brittle nails, the next poor appetite, especially in infant and children with iron deficiency anemia. These are the signs and symptoms of iron deficiency anemia. So what are the causes of this iron deficiency anemia? First, that is first cause, increased iron need. Then second, decreased iron intake or the decreased iron absorption. In that first, increased iron need, there are many common conditions. In various conditions, there is the need of iron is increases. First, because of rapid growth infant, and it requires more iron than the older children. Sometimes it can be hard for them to get enough iron from their normal diet. Then without iron supplementation, iron deficiency anemia occurs in many pregnant women because their iron stores need to serve their own increased blood volume as well as be a source of hemoglobin for growing a fetus. It means what? There is increased iron needs in, for example, in case of rapid growth, in case of infant, then in case of pregnancy. Then third, that is when people lose blood, they are also lost the iron. It means in case of blood loss, there is requirement of, or there is increased iron need. In case of blood loss, they require, or they need extra iron to replace what they have lost. So increased blood loss can occur with heavy menstrual periods, frequently blood donation, as well as with the same stomach and intestinal conditions. Then next, that is decreased iron intake or the decreased iron absorption. This amount of iron absorbed from diet, which is depend upon different factors. In that first, iron from meat, poultry and fish, that is heme iron, it is absorbed 2 or 3 times more efficiently than iron from a plant, that is non-heme iron. See, I am repeating here, this iron from meat, meat, poultry and fish, that is heme iron, which is absorbed 2 or 3 times more efficiently than iron from plant, that is non-heme iron. Then food containing heme iron enhance iron absorption from the food and that contain a non-heme iron. The substances such as polyphenol or calcium that are part of some food or drinks such as tea, coffee or whole grains or the legumes or the milk, that decreases the amount of non-heme iron absorbed at a meal. And this calcium is also the calcium can also decrease the amount of heme iron absorbed at a meal. This vegetarian diet are low in heme iron. The vegetarian diet, which is low in heme iron, but careful meal planning can help increase the amount of iron absorbed. The next, that is different risk factors. For example, in this factor, woman, because of woman lose blood during menstruation, the woman in general are at risk in iron deficiency anemia because there is blood loss during menstruation. Then second, infants and children, especially those who were low birth weight or born prematurely or who don't get enough iron from breast milk. Then vegetarians, people who don't eat meat may have greater risk of iron deficiency anemia if they don't eat other iron rich food. Then frequent blood donors, people who routinely donate the blood may have increased the risk of iron deficiency anemia since the blood donation can deplete iron stores. Then complications, that is heart problem, and second, that is problem during pregnancy. In heart problem, the iron deficiency, it may cause a rapid or the irregular heartbeat, and this heart must pump more blood to compensate for the lack of oxygen carried in blood when the patient is anemic. And in problem in pregnancy. Then third, that is growth problems. In infants and children, severe iron deficiency can lead to anemia as well as delayed growth and the development. Due to this iron deficiency, what will happen? There is delayed growth as well as development.